Okay, ever get that, like, nagging jaw pain? You know, that clipping and popping? Drives you crazy. We're talking TMJ today, that tricky temporomandibular joint disorder. And in this deep dive, we're exploring, well, the what if. What if, the stretches and mouth guards and even giving up your beloved chewing gum? What if all that, it just isn't enough? What if surgery becomes, like, the only option left?
Yeah, that's definitely not a decision anyone makes lightly.
Right, and that's why we're here. We want to help everyone understand just how complex TMJ surgery can be.
Exactly.
We've got a ton of research, and honestly, some of it gets, like, really detailed. We're going to cover all the types of surgeries, the potential costs, and what recovery actually looks like. But before we jump into all of that, let's just take a step back, make sure we're all on the same page. What exactly is TMD?
So TMD refers to any problems with the temporomandibular joint. Those two, well, they're small, but they're mighty hinges that connect your jaw to your skull. And when they're not working the way they should be, it can cause a whole bunch of symptoms.
Yeah, it's way more than just, like, a little jaw pain, isn't it? So what are some red flags? Like, how would someone even know they might have TMD?
Well, persistent pain is a huge one, obviously, but you can also have clicking or popping in your jaw, stiffness, difficulty opening or closing your mouth, or even your jaw, like, locking up. And some people even get tinnitus, which is a ringing in their ears.
Tinnitus, wow, I never connected that with TMJ before.
Yeah.
So is there any way to figure out what actually causes all these problems?
Honestly, a lot of times it's a bit of a mystery. Genetics, hormones, past injuries to the jaw, those can all play a role. But there are a lot of cases where we just don't know the exact trigger.
So it's kind of like a detective novel, right? Trying to put the clues together.
Exactly.
Well, let's talk about the elephant in the room, surgery. When does that even become something you'd consider?
Surgery is always the absolute last resort. It's only considered if conservative treatments, things like physical therapy or medication or mouth guards, if those haven't provided any relief that lasts.
So it's a pretty serious decision.
It is, and it's so important to understand that a lot of TMJ surgeries, they can't be reversed. So getting a really thorough evaluation from a qualified specialist, that's super important.
Okay, that's a big one to consider. And speaking of serious, I was going through the research and I was blown away by just how many surgical options there are.
Yeah, there's quite a few.
It's definitely not one size fits all, is it?
Not at all. You've got a whole range of procedures from minimally invasive techniques to like full-on joint replacement.
Wow. Okay, so let's start with the least invasive stuff. We've got arthrocentesis on the list. What is that?
Arthrocentesis, you can think of it as a joint wash. Basically, the surgeon inserts needles into the joint and flushes it out with a sterile solution, gets rid of any debris and inflammation.
So like a deep clean for your jaw.
Exactly. And it can actually be pretty effective in some cases. It's kind of like hitting the reset button for your joint. And sometimes they'll also inject some medication during the procedure just to reduce that inflammation even more.
Interesting. So pretty simple procedure, shorter recovery time. Got it. What about, let's see, the next step up, we have arthroscopy here.
Yeah, arthroscopy is a little more involved, but it's still minimally invasive. The surgeon uses this tiny little camera and special instruments. They go in through like really small incisions so they can actually see inside the joint.
So it's like mini surgery happening right in your jaw.
You could say that, and they can do repairs in there, like removing scar tissue or repositioning the desk or even smoothing out bone spurs.
That's amazing. All through these tiny incisions. Okay, so what if these less invasive things, they just don't cut it? We've also got open joint surgery on the list. And that sounds a bit more intense.
Yeah, it is, and for good reason. Open joint surgery means a bigger incision so they can fully expose the joint. It's usually reserved for more complex cases, if there's significant damage or major structural abnormalities.
So a much bigger procedure, longer recovery, right?
Right. The surgeon has a lot more access, but it does come with more risks. And recovery, yeah, it's going to take longer.
Got it. So we've gone from like a deep clean to some more serious repairs. Now we're talking open surgery. But then there's also, wait, TMJ replacement? Is that what it sounds like? Like artificial jaws?
You're not far off. TMJ replacement, that means they remove the damaged joint and replace it with a prosthesis. It's a major surgery, but it can really change people's lives, especially if nothing else has worked.
Wow, that's amazing. Medical technology just keeps getting more and more incredible. Okay, there's one more on our list. Modified condylotomy. What even is a condylotomy?
So a condylotomy, it's basically a controlled fracture of the condyle. That's that rounded end of your jawbone that fits into the TMJ socket. They do it to try to improve jaw movement and reduce pain by repositioning the condyle.
Wait, a control fracture. They're intentionally breaking your jawbone.
It sounds scarier than it is. It's a very precise procedure. The goal is to relieve pressure on the joint. Recovery, though, it does involve having your jaw wired shut for like weeks.
Okay, yeah, that definitely takes the idea of a liquid diet to a whole new level. All right, so we've got a whole range here from pretty minimally invasive to like full-blown joint replacement. But let's be real, none of this is cheap, right? What kind of costs are we talking about?
Yeah, you're right. The costs can vary a lot, depends on the type of surgery, the surgeon's fees, even your location. Arthrocentesis being the least invasive, it can start as low as like $300. But on the other end, a TMJ replacement, that could be anywhere from $40,000 to $70,000.
Whoa, that's a huge range, like from a nice dinner out to a new car, and I'm guessing insurance plays a big role in all this.
Definitely. Some insurance plans will cover a lot of the costs, others not so much. It's really important to do your research on your specific plan and talk to your insurance company before making any decisions.
Yeah, absolutely. You need to know what you're getting into financially. Okay, let's switch gears a bit. Let's talk about recovery. What can someone expect after one of these procedures?
Recovery time, just like the cost, it varies a lot. Depends on the type of surgery. Arthrocentesis, usually just a few days of downtime. But something like open joint surgery or a joint replacement, that can take weeks or even months to fully recover.
So no matter what, you're making a real commitment to the recovery process.
Yeah.
I imagine following the doctor's instructions, that's got to be super important.
Oh, absolutely. Do exactly what they tell you to do after surgery. Go to all your follow-up appointments, and if they recommend physical therapy, do it. All of that is key for a smooth recovery.
Okay, that makes sense. But, before we wrap up, I just want to say surgery isn't the only path, right? What about non-surgical treatments for TMD? Give us a little hope before we get too deep into this surgical world.
Yeah, of course. Surgery is always the last resort. Remember that. There are lots of non-surgical treatments that can be really effective at managing TMD symptoms, and we're going to be getting into all of those in the next part of our deep dive.
All right, so we've gone through the whole surgery thing, but you did mention there's some hope with these non-surgical options. So where do we even begin with those? It seems like there are tons of possibilities.
Yeah, there really are. And kind of like surgery, the right treatment for you, it really depends on you as an individual and what's specifically going on with your condition.
Okay, so let's break it down. What are some of the non-surgical approaches that could help someone get some relief?
Well, physical therapy is usually the first thing we try. A good physical therapist can do wonders, teaching you exercises to like stretch and strengthen all those muscles that control your jaw movement.
So it's like retraining those jaw muscles, getting them to work better. What kind of exercises are we talking about here?
Oh, there are all sorts. You've got gentle stretches, targeted strengthening exercises. Some focus on improving how much you can move your jaw. Others are more about fixing muscle imbalances or tension. It's really all about figuring out what works best for each person.
That makes sense. It's not one size fits all. But what about when stress or anxiety seem to be a big trigger? For clenching your jaw or grinding your teeth. Is there anything you can do about that?
That's where something called cognitive behavioral therapy, or CBT, comes in. It might sound a little surprising, but CBT can be really helpful for TMD, especially when stress is a big part of the picture.
Therapy for your jaw. How does that even work?
So CBT helps you become more aware of those habits you might not even realize you're doing, like the clenching or grinding. And it teaches you techniques to manage stress better and like actually change those behaviors. It's about breaking those patterns that contribute to the pain and dysfunction.
Interesting. So you're kind of addressing that whole mind-body connection, right? Retraining those automatic responses. Okay, what about medication? Does that play a role in managing TMD?
Sometimes, yeah, your basic over-the-counter pain relievers like ibuprofen or naproxen, those can help with the pain and inflammation, but it's temporary. And then in some cases, a doctor might prescribe something stronger like muscle relaxants or even low-dose antidepressants for chronic pain.
So there are options, both short-term and long-term, for the pain management piece. Earlier, we talked about mouth guards as a conservative treatment. Can you remind us how those work? And who would they even be helpful for?
Yeah, so orthotic devices, things like mouth guards or splints, those are really helpful for people who clench or grind their teeth, especially at night. They basically reposition the jaw and reduce muscle tension, and they also protect your teeth from like wear and tear.
So it's like giving your jaw a break, especially while you sleep when you're not even aware of what you're doing. I've even heard of people using Botox for TMD. That seems a little out there. How does that even work?
Botox injections, they can be used to temporarily relax those muscles that are involved in jaw clenching and teeth grinding. It's not a permanent fix, but for some people, it can really help with the pain.
So it's kind of like hitting the reset button on those overactive muscles. Okay, are there any approaches that focus on those deeper connections in the body, like the fascia, the nerves, that kind of stuff?
Definitely. There are therapies like acupuncture and myofascial release that can target those areas. Acupuncture, that's where they insert those thin needles into specific points on the body to try to stimulate healing and reduce pain. And myofascial release, that's more hands-on. It focuses on releasing tension in the fascia, which is that connective tissue that surrounds our muscles.
Thinking back to all the surgery stuff we talked about, It seems like making an informed decision is just like the most important thing. So how can someone even navigate that whole process, especially with so many options out there?
The first thing, and this is so important, is to find a healthcare professional that you really trust. Someone who specializes in TMD and will actually take the time to figure out your unique situation.
So it's not as simple as going to like any dentist or doctor?
Not necessarily. You want to find someone with experience treating TMD and who offers a range of options, both the surgical and the non-surgical.
Okay, so you're on your specialist. What happens next?
They're going to take a super detailed medical history, do a physical exam, and they might even order imaging tests, things like x-rays or an MRI. All of that's to get a clear picture of what's happening with your jaw joints.
It's like they're a detective, but for your jaw. What kind of questions should you be asking your doctor or surgeon during this whole process?
Oh, don't be afraid to ask a ton of questions. You need to understand why they're recommending certain treatments, what they're hoping to achieve, and what the risks and benefits are. Ask about their experience, their success rates with different procedures.
So it's about being an active participant in your own healthcare, Wine. And remember, you can always get a second opinion.
Always. It's your health, and you have every right to make sure you're getting the best possible care. And keep in mind, choosing a treatment, it should be a collaborative thing. You should feel comfortable and confident in whatever you decide to do, along with your healthcare team.
That's a really important point. Okay, so let's say you've gone through the whole process. You've chosen your treatment, and you're on the road to recovery. What happens then? Is it smooth sailing from there?
Hopefully. But managing TMD, it's often an ongoing thing. You might have to make some lifestyle changes, find ways to manage your stress, and even go from regular checkups so they can track your progress.
So it's more than just the treatment itself, right? It's about long-term care, making some lasting changes.
Exactly. It's a journey, not just a destination.
I like that. Okay, we've covered so much, from all the different types of surgery to the whole world of non-surgical treatments. But before we wrap things up, I want to go back to something we touched on earlier, prevention. Is there anything people can do to, like, lower their risk of getting TMD in the first place?
That's a great question, and I think it's something people don't talk about enough. We can't, completely eliminate the risk, but there are definitely some things we can do to keep our jaws healthy and lower our chances of developing TMD.
Okay, so tell us, what are the secrets to a happy, healthy jaw?
One of the biggest things is managing stress. We talked about how stress can lead to jaw clenching and teeth grinding, and that puts so much strain on the TMJ. So finding healthy ways to manage that stress, things like exercise or meditation or even spending time in nature, those can all be so helpful.
So self-care isn't just about pampering yourself. It's about protecting your jaw, too. What else can we do?
Pay attention to your posture. Bad posture can actually throw your jaw and neck out of alignment, and that leads to tension and pain.
All right, everyone, sit up straight, stand tall. Your jaw will thank you. Anything else?
Be mindful of what you eat. Try not to chew gum all the time, and watch out for sticky or hard foods that make your jaw muscles work overtime.
Oh, the gum chewing. I'm definitely guilty of that. What about sleep? Does that affect jaw health?
Absolutely. The way you sleep can actually affect your jaw alignment. Sleeping on your stomach can put pressure on your jaw, so sleeping on your side or back is usually better.
No more face planting into the pillow. And if you're a teeth grinder, definitely get yourself a mouth guard.
Exactly. A mouth guard will protect your teeth from getting damaged and reduce all that muscle tension while you sleep.
Wow, this is all such great advice. It seems like taking care of your jaw is really about making these small but important changes to your daily habits and your lifestyle.
You got it. It's about being aware of your jaw health and being proactive about protecting it.
This has been such an amazing deep dive into the whole world of TMJ. But before we sign off, I want to leave our listeners with one final thought-provoking question. We've talked a lot about addressing symptoms and getting relief, but what about those underlying causes we talked about at the very beginning? Could digging deeper into those root causes be the key to, really healing in the long term and preventing problems in the future?
That's such an important question, and it's one we're going to really explore in the final part of our deep dive.
All right, so we've gone deep into TMJ, right? From surgery to all those non-surgical treatments, but I keep thinking about that last question we asked. The underlying causes of TMD.
Yeah, it's definitely a question worth exploring more. I mean, think about it. Wouldn't it be amazing if we could, address the root cause of TMJ and prevent it from even happening in the first place?
That's the dream, right? We talked about stress, posture, habits, but is there even more to it? You mentioned the nervous system playing a role.
Yeah, so the nervous system is the control center for your whole body, and it plays a big role in TMJ. Specifically, there's this nerve called the trigeminal nerve. It's the largest of the cranial nerves, and it controls all the sensation in your face and the muscles you use for chewing.
So if the trigeminal nerve is messed up, could that cause problems for your TMJ?
Definitely, and here's where things get really interesting. The trigeminal nerve, it's super sensitive to stress. And when you're dealing with chronic stress, it can set off this whole chain reaction, leading to muscle tension, inflammation, and pain in the jaw joint.
So stress isn't just like a mental or emotional thing. It can actually show up in your jaw muscles.
Exactly. It just goes to show how powerful that mind-body connection really is. But there's another piece to this puzzle: fascia.
Okay, remind me about fascia again. It's that connective tissue around our muscles, right?
Right. It's like a web that connects and supports everything in your body. And here's the important part. Fascia can get tight or restricted, because of an injury or bad posture or even emotional stress.
Wait, emotional stress can make your fascia tighter? How does that even work?
It goes back to that mind-body connection. When we're stressed, we tend to hold tension in our muscles. And that tension, it can transfer to the fascia around the muscle and make it restricted.
So it's like our fat is this giant stress meter for our bodies.
Kind of, yeah. And if the fascia in your neck or shoulders is tight, it can actually pull on your jaw and contribute to TMJ issues.
Wow, it's all connected. It makes you realize that fixing problems in other areas of your body could really help your jaw. You said we've only just scratched the surface of potential causes, though. What else is there?
Well, there's actually a lot of research now looking at the connection between gut health and TMJ.
The gut? Like our digestive system? I don't really see the connection.
It might seem weird, but remember, everything in the body is connected. Your gut and your brain are constantly talking to each other. And if something's off in your gut microbiome, those trillions of bacteria that live in your digestive tract, it can trigger inflammation all over your body, including in the TMJ.
So those little bacteria in our gut could be making our jaws hurt. That's crazy.
It is, and it opens up this whole new way of thinking about how we could treat and prevent TMJ. What if we could make people's gut health better, through diet and lifestyle changes, and help their TMJ pain at the same time?
It's mind-blowing when you think about all these different systems in our bodies and how they all work together.
It really is, and it shows how important it is to take a holistic approach to TMJ, an approach that looks at the whole person, not just their symptoms.
This deep dive has been a real eye-opener. We started with a simple jaw problem and ended up on this fascinating journey through the human body.
And that's what we love about these deep dives. They challenge what we think we know and show us just how complex even the simplest things really are.
Okay, so if we had to sum up the key takeaways from our deep dive on TMJ, what would they be?
Well, the first one is this. If you're having jaw pain or any other TMJ symptoms, don't give us hope. There are treatments out there, surgical and non-surgical, that can really help. Yeah.
And finding the right healthcare professional, someone you trust, that's crucial. You want someone who will really listen to you, figure out exactly what's going on, and help you decide what to do.
Exactly. Be your own advocate, ask all the questions, do your research, and make sure you feel good about the choices you make with your healthcare team.
And it's not just about treating the symptoms, right? It's about figuring out those underlying causes, whether it's stress or posture or gut health or something else entirely.
True healing, it's about more than just fixing the physical problem. It's about understanding the whole person and finding solutions that help them feel better in every way.
This has been such an amazing journey, and I hope everyone listening feels inspired to keep learning about their own health, their jaw health and beyond.
Thanks for joining us on this deep dive.
Until next time, stay curious and keep exploring.